The science about vaccination is very clear about the benefits of vaccination during pregnancy against some risks to both mother and infant. What the study suggests is that the population as a whole, which is the community that surrounds the pregnant person, and this study also has people of childbearing age in it, it doesn't recommend those vaccines or isn't ready to recommend those vaccines, which doesn't necessarily mean that the public wouldn't recommend the vaccines. It can mean they just don't have enough knowledge to know whether they would recommend the vaccines. Nonetheless, we would like to see the population as a whole understand that there are vaccines that are important during pregnancy because we know about their protective effects and we know about the risks of the illnesses they protect against. And we'd like a higher level of knowledge in the community at large about those benefits, and as a result, a greater willingness to support vaccination. Well, first, think about all the things that an individual is told when they become pregnant. They're told, be really careful about your health. In fact, be careful about your health before you become pregnant. As you're making the decision about becoming pregnant, if you're smoking, stop. If you're drinking, stop. So we actually start giving health advice as you think about becoming pregnant. And then during pregnancy, we tell people a lot of things about what they shouldn't do, as well as some things that they should do. But we're basically cautioning that when you're pregnant, you've got an additional need over and above all of your other needs to make sure that you're taking care of your health, because you're now taking care of the health of two, in essence. So when you put that cautionary environment in, and then you say, now, should you vaccinate, you can understand some wariness of the pregnant individual and those who think about pregnancy to say, well, wait a minute, there are all these things I've got to be really careful about. I need to make sure that this is really safe. So this is one of those instances in which you don't need a lot of misconceptions out there in order to understand a wariness about recommending vaccination or about taking vaccination. And then you add to that now people, particularly in the case of a COVID vaccine, saying, no, you should not take the COVID vaccine, or there isn't sufficient research to suggest that you should. And that in this environment adds to an environment which there's a justified wariness, an effort to try to protect against anything that might create harm. Those two things synergize, they interact with each other, they potentially affect each other to increase the likelihood that people say, well, when in doubt, don't do it. Then you add to that the CDC withdrawing its recommendation. It had recommended the COVID vaccine, and just simply withdrawing it, putting on the website, there's not a recommendation. They're not making a recommendation against at this point, but they're not recommending for either. And now you've added one more layer of uncertainty. And if you trust the CDC recommends the other three vaccines we studied, still on their website. They still recommend RSV, Tdap, and flu. Well, then you see that, well, they don't recommend this one. Well, maybe I shouldn't get this one. Wouldn't be a difficult conclusion to understand. So this is complex in ways that the decision simply to vaccinate ordinarily without pregnancy being involved is not. These are different in some important ways. We know that when we do trust studies, as we do, we've been tracking trust in your healthcare provider, trust in various federal agencies across time. And what we know is the one persistent finding is that you trust your healthcare provider. If your healthcare provider says you should vaccinate, the likelihood is the person is going to accept the vaccine. If the person has hesitance, and the provider asks what the basis for the hesitance is, and then talks through how science has looked at this as an intervention and found that the benefits vastly outweigh the risks, and the risks of the disease are potentially very serious, we increase the likelihood dramatically that people will do what their healthcare advisor advises. So in the whole universe of people who can make a difference, the healthcare provider still has the highest trust. That person makes the recommendation, listens, and explains. The likelihood you're going to have vaccination accepted goes way up. We know that. And that places a special responsibility on people who are very well prepared to carry it, because our healthcare providers are trained in the science. They're trained in understanding and listening to people and addressing their concerns. We're fortunate that trust in our healthcare providers remains so high because they're in the right place at the right time with the right knowledge and the right relationships to actually matter. No, you're talking to the healthcare providers in this case who are going to make a difference. And when they make these recommendations, they potentially are saving individuals from serious health consequences, which can, in some cases, include dying.